David Schiller here, and today we're going to be talking about type 2 diabetes and the medications and/or supplements that people take to try to treat their diabetes. And my disclaimer is I'm not here to tell you to come off your medication, but just to educate you about what happens when you do take certain supplements or certain medications to treat your diabetes. Now, a lot of the medications that are out there and some of the supplements that are out there, many people do searches on the internet. They're being told by their doctor that they have a blood sugar issue and we're going to watch it. I'll see you in 6 months. I want you to eat better or exercise more. And they're going to come back and see you, but you're going to be doing your little searches on the internet to find certain things, certain supplements even, that are going to be treating your type 2 diabetes or pre-diabetic state. And the answer is that these medications, many of the medications, actually tell the pancreas to make more insulin. And that is not a good thing, because most people that have diabetes or are pre-diabetic have what is called insulin resistance. You're making enough insulin already, just that your body doesn't recognize it anymore. Think of your lifestyle over the years that led you to have the diabetes. One of the things being what you were eating all these foods that break down into sugar very quickly, so constantly your body is having to deal with high levels of blood sugar. So as a result, it was constantly releasing more and more insulin, and eventually the body's receptors to that insulin stopped listening. That is what is called insulin resistance. So many of the medications and some of the supplements, not all the medications, not all the supplements, but many of them do, is they start stimulating the production of more insulin, which can be really detrimental to the person's health. So as a result, they take the medications, they start producing more and more insulin, or telling the body to produce it more and more artificially, and what happens is that pancreas starts getting burnt out. It literally starts to kill off the cells, the beta cells, the islets of Langerhans in the pancreas itself that are making the insulin. So as a result, the problem gets worse. The medications don't work anymore, and as a result, they are now starting to talk to you about going on to insulin. Now, insulin in and of itself can be an issue, it can be a problem, because insulin is an inflammatory hormone. It causes inflammation in the body. And inflammation, for the most part, is what caused you to have the problem in the first place. So it's like adding fuel to the fire, creating worse and worse of a situation where once you go on insulin, it really becomes a downward spiral where more and more complications start occurring, more and more ill health. You start developing kidney issues, you start developing potentials for neuropathies, which is the numbing and tingling or destruction of your nerve cells, etc. The brain starts becoming more and more destroyed because of the inflammation that's being produced in general from why you had the problem in the first place, and then from the exact medications that you're now taking to treat the problem. So what you want to do is you want to find a doctor who understands these mechanisms and will find out, looking at you from a holistic perspective, looking at all your systems, looking at the thyroid, the liver, the adrenal glands, and the pancreas, because those are the things that help you regulate blood sugar, looking at where your inflammation is coming from, if it's coming from bad food choices or injuries that are never healed or too much exercise. You need to find out all these things, find a doctor who understands all these mechanisms so they can get to the bottom of your problem and start getting you onto a road to better health. So I want to thank you for watching, and I hope to see you soon, and make it a great day.